of our frequently asked questions that we get is what kind of things do we bring to the birth? So I want to give you guys a little look at what we have here. We often get asked what kind of medications we have. So our first medication I want to show you guys is penicillin that we give for moms who are Group B strep positive to receive penicillin in labor. For postpartum bleeding, we have Pitocin that we would administer in an injection in the thigh. In the hospital, they tend to do it through an IV, and although we do have IV fluids here, we try not to run them routinely. In fact, I'd really love for you to have a needle-free birth. So if you don't have an IV run that we can put Pitocin in, we just give you an injection in the thigh if it's necessary. For minor bleeding that we don't necessarily need to go into medications for, I have two herbs that I prefer to use. The first one's called shepherd's purse. I actually give a full dropper full for moderate bleeding that wouldn't necessarily require Pitocin yet. And this actually helps the uterus to clamp down and stop bleeding. Angelica was actually an herb that was taught to me by my midwife who trained me, that she used to say angels will bring down the placenta. And so if we're having a tough time getting the placenta out, which, in this environment, we can wait up to 45 minutes or so after the birth to deliver the placenta. If things are taking a little longer than usual, I'll give Angelica. Arnica is a homeopathic that many of you are probably already familiar with. Arnica we use for postpartum, like tenderness and swelling. We can actually apply it topically to the bottom, or moms can take it by mouth. Babies can also take it by mouth if it was kind of a traumatic birth. And rescue remedy. This, thankfully, I don't have to use very often, but if babies need a resuscitation, or if mom's having a little bit of anxiety, or dads having a little bit of anxiety, rescue remedy is definitely one of the things that we love to use. We carry the same delivery instruments that they carry at the hospital: cord clamps, sharps containers, and all of that. For postpartum, after the baby's born, we do suturing here at the birth center. We do use lidocaine, so even though you're having an unmedicated birth, we'll still numb you up for that. And same things that you're familiar with: sterile suturing equipment. We carry both Vicryl and chromic depending on the situation. As a midwife, in addition to being trained on medicines that are safe for birth and moms, we also carry homeopathics to the birth. Each one of us kind of carries our own different kit. This is my homeopathic kit, and as you can see, there's just too many for me to go over with you here on video. But the one that I like to talk about, because it's the one I use the most often, is a homeopathic we call antimonium tart. And this is an amazing homeopathic that we crush up here in this. And with a little bit of colostrum, we stick it in baby's cheek, and it actually can help baby clear out those wet lungs if they're sounding a little wet after the birth. And then everyone who comes to your birth is CPR and NRP certified. NRP means Neonatal Resuscitation Protocol. And basically, long story short, what that means is, in the event of an emergency, both myself and my birth assistant can resuscitate mom and baby. And so we have these resuscitators here. Obviously, one's for the infant. We do carry oxygen to the births, and we have masks and tubing and things like that for our babies and our moms as well.